Coming to middle ear is also called as tympanic cavity, or sometimes it is also mentioned as tympanum. So middle ear is same as that of the tympanic cavity. Sometimes they can mention it as tympanic cavity or tympanum also. The middle ear is a bony cavity within the petrous temporal bone. It is one of the bones of the skull. In the petrous part of the temporal bone, we can locate the middle ear. And it is lined, if you see the cavity of the middle ear, it is lined by mucous membrane and it is filled with air, which is derived from the nasopharynx through the auditory tube. So the middle ear is not a totally closed cavity, but it is communicating with the nasopharynx through the auditory tube, also called as the eustachian tube. Okay, so the middle ear directly communicates with that of the nasopharynx. So this cavity is present within the petrous part of the temporal bone, and it is lined by mucous membrane and it is filled with cavity, and the air is coming from the nasopharynx. Okay. It intensifies the force of sound vibration without altering the amplitude 15 to 20 times more than that of the tympanic membrane. Okay, so this has the capacity to intensify the force of the sound vibrations without altering the amplitude. That is important. And it increases almost 15 to 20 times more than that of the tympanic membrane. And these vibrations which are generated here are transmitted from the tympanic membrane to the fenestrate vestibuli, that is the round window, okay, into the by the movement of the ossicles of the ear. In the middle ear we'll see that there are ossicles which will transmit the vibration all the same. So it will be communicating through this tube into the nasopharynx. As I said before, it is filled with air and lined by mucous membrane, and this middle ear assumes the adult size by birth. So already by birth it will be already the size of an adult, and its vertical and anterior-posterior diameter are about 15 millimeters. Okay, so it is approximately like a cube, but not exactly. But the vertical, the highest diameters in the vertical as well as anterior-posterior diameters will be 15 millimeters. And as I said, the communication in the front with the lateral wall of the nasopharynx via the auditory tube. So it will be communicating to the eustachian tube or the auditory tube with the nasopharynx in the front. And behind, in the posterior wall, it will be communicating with the mastoid antrum. Okay, through the auditors to the antrum. We'll see the mastoid antrum itself. It is present within the mastoid process. Okay, so that we'll see later. So this area or the middle ear is sandwiched between the external and the internal ear. External is outside and the internal is inside. So in between this area, that is the middle ear, is sandwiched, and on coronal section it resembles, even though I said it, the anterior posterior and the vertical diameters are almost 50 millimeters. It should look like a cuboid box, but it is actually in the middle, it is compressed. So it looks like a biconcave disc, just like that of the shape of the RBC. Okay, is very narrow compared to the lower and upper part. So it looks like as though it is biconcave, just like that of the shape of the RBC. As I said, because it is compressed at the center and enlarged at the peripheries, because of the shape of the tympanic membrane itself in the external ear and the internal ear from the inside. So this is the shape of the tympanic membrane. So you can see here it is invaginating, bulging inside. Okay. Coming to the contents, what exactly we see within the tympanic cavity or the middle ear. So in the middle ear, it is lined by mucous membrane and consists of 3 ossicles, 3 small bones. These are called as ossicles. So here you can see here, these are the 3 ossicles, and we see 2 muscles and 6 sets of blood vessels and 4 sets of nerves. Okay, the 3 ossicles, as you know, is the malleus, incus as well as the stapes. So these are the 3 bones here. So this is the malleus, this is the incus, and this is the shape of the stapes. Okay, these are the 3 small bones which will be present, which are called as ossicles, will be present in the middle ear. Along with that, there are 2 muscles. These are the tensor tympani as well as the trapezius. These are the 2 muscles which will be present here. See here, 3 ossicles and there are 6 sets of blood vessels, just double, and 2 muscles and 4 sets of nerves. Okay, we'll talk about this blood vessels and nerves later when we talk about the blood supply and supply. Okay, so these are 3 ossicles and 2 muscles. Okay, 3 ossicles are malleus, incus and stapes, and 2 muscles, tensor tympani as well as the trapezius. Along with that, there are ligaments of ear ossicles. They are very small ligaments, so that the 2 bones are connected to each other, but we will not go into details about these ligaments. We will try to keep it as simple as possible. Coming to the malleus, this is the malleus. So this is the head of the malleus. This is the neck of the malleus, and it has 2 processes, anterior process as well as the lateral process. And we have already seen the handle of the malleus, which goes up to the middle of the tympanic membrane, which is in contact with the tympanic membrane, and which will be connected. The umbo part, the bent part, will be almost at the center of the tympanic membrane. Okay, so this is the handle of the malleus, this is the lateral process, this is the anterior process, this is the neck of the malleus, and this is the head. And this malleus will be articulating with that of the incus. Okay, so the incus will articulate here. This is the incus here, incus bone. Okay, this will be articulating here. This is called as the incus articulation, where the incus will be articulating here. This is called as the malleus articulation. Okay, so this is where the malleus and incus will articulate. Okay, this incus has a body. This is called as the body of the incus, and 2 limbs, short limb as well as the long limb. This is the short limb, which is a horizontal limb, and the long limb will be vertical. Then this is the stapes. So this is the head of the stapes, and it has 2 limbs. This also has 2 limbs, anterior limb and the posterior limb, and it has a base. Okay, so this is the base of the stapes. Coming to the subdivisions of the middle ear is divided into 3 parts: the epi-tympanum, the meso-tympanum as well as the hypo-tympanum. As the name itself indicates, epi means above. Okay, epi-tympanum, so it is above the tympanum. This is called as also called as the attic. Okay, above the tympanic membrane consists of the head of the malleus and the body as well as the short process of the incus. If you see here, so this is, if you see, this is the middle ear, the whole thing. So the part which is above the tympanum, so the tympanic membrane, this is the tympanic membrane which is above the tympanic membrane. This part is called as the epi-tympanum. This is called as the meso-tympanum, which is behind the tympanic membrane, and below this is called as the hypo-tympanum. Okay, so this is the epi-tympanum, also called as the attic. So where we can see the head of the malleus, as the body as well as the short process of the incus. So here you can see the head of the malleus, the body as well as the short process of the incus. Body and the body of the incus as well as the short process. Okay, then in the meso-tympanum, which is just opposite to the tympanic membrane, that is this part. So here this is called as the meso-tympanum, where we can see this is the narrowest part. As I said, it is because at the middle part it will be very narrow, so which contains the handle of the malleus, the long process, and of the incus and stapes. So here you can see this is the handle of the malleus, the long process of the incus, and both the limbs of the stapes. All these are present in the meso-tympanum. And in the hypo-tympanum, which is below the membrane, this will be communicating here with the nasopharynx. This is called as the pharyngo-tympanic tube, or it is also called as the Gestation tube, or it is also called as the auditory tube. So all three are same. So when they mention tubo-tympanic tube, it is nothing but the Gestation tube or the auditory tube. So this is the middle ear. This whole thing is the middle ear, epi-tympanum, meso-tympanum, and the hypo-tympanum below. Coming to the boundaries of the tympanic cavity, so as I said, it looks almost like a cuboidal box, even though it is not exactly cuboidal, because at the center, as we said, it is compressed. But still, if you imagine it as the box, cuboidal box, it will be presenting with 6 walls: the roof, the floor, anterior wall, posterior wall, medial, as well as the lateral wall. So this is how it looks like. This is the picture taken from the student's grace, and this has depicted the things very elegantly here. Okay, so here this is the roof. So starting with the roof is made up of the tegmen tympanum. So if you see here, this is the tegmen tympanum. So this roof is much more wider compared to the floor. Okay, so even though we said it is like a cuboidal box, but not exactly, because the roof is larger compared to the floor. Floor is narrower, much more narrower. Okay, and you can trace here the lesser and greater petrosal nerves which will be piercing the roof. It has not been shown here, but you can imagine that they will be piercing, the lesser and greater petrosal nerves will be piercing this roof. Coming to the floor is formed by the jugular fossa. Okay, if you see here you can see this is the internal jugular vein. So the presence of internal jugular vein will lead to the formation of a fossa on the floor, that will be called as the jugular fossa. The tympanic branch of the glossopharyngeal nerve pierces the floor and enters the tympanic cavity. If you see here, so this is the tympanic branch of the glossopharyngeal nerve, which will be piercing the floor and enters the tympanic cavity, that is the middle ear. Coming to the anterior wall, the upper canal for the tensor tympanic muscle, the lower canal for the bony part of the auditory tube. So if you see here, above here, this is one of the two muscles we are talking about. So I said there are two muscles here within the cavity of the middle ear. So one is the tensor tympani, the second muscle is the stapedius. So this is the stapedius here, the pyramidal eminence of the stapedius. This is the tensor tympani muscle. So this tympani, this is the anterior wall here. So this above we can see trace the tensor tympani muscle. Okay. So the upper canal for the tensor tympani. So there is a canal here through which this muscle is passing. So this is the upper canal, which is for the tensor tympani, and the lower canal here, this is the larger one. This is for the pharyngo-tympanic tube, or the Gestation tube, or auditory tube, which communicates with the nasopharynx. So this is the communication of the nasopharynx with that of the middle ear. Then then coming to the posterior wall. So the lowermost part by the bony carotid canal. Okay, so we missed that one. So this is the internal carotid artery. So this presence of internal carotid artery leads to formation of the bony canal for the carotid artery. So that will be present here. Okay, so because of the presence of this internal carotid artery, there will be a canal here near the lower part of the anterior wall. Coming to the posterior wall, posterior wall will be to the auditus to the mastoid antrum. I said there will be communication. Anteriorly, it will be communicating with the tubo-tympanic process into the nasopharynx. Posterior to the mastoid process through the auditus. This is the opening. Auditus means opening to the mastoid antrum. We'll see that mastoid antrum as well as the mastoid process. Okay, so posteriorly it is communicating here through the auditus to the mastoid antrum. Okay, the posterior wall will be having the auditus to the master antrum, the fossa, okay, fossa, insidus, canal of the facial nerve, and hollow pyramidal eminence. So here you can see here. So this is the prominence of the lateral semicircular canal. Then we have the canal for the facial nerve. This is called as the facial canal, and the pyramidal eminence of the stapedius muscle. So all this will be present here. Okay, coming to the medial wall, then you can see there is promontory, oval window, round window, oblique facial canal. So here you can see here. So this is the promontory. So this is the imagination here into the middle ear. This is the promontory, and here you can trace the oval window above and the round window below, and also you can see the process of the facial canal passing through this wall also. Okay, then coming to the lateral wall. Lateral wall is that wall where we are tracing all the structures. So this here it is not shown here because we wanted to see inside. So the lateral wall, it is mucus covered medial surface of the tympanic membrane. So it will be the wall will be totally closed, and it will be covered by mucous membrane, and the medial surface of the tympanic membrane will be there. Okay, here. Coming to the arterial supply. Arterial supply, the blood supply of this middle ear is by the anterior tympanic branch of the maxillary artery, as well as the posterior tympanic branch of the posterior auricular artery. Coming to the venous drainage, it will be draining into the superior petrosal sinus as well as the pterygoid venous plexus, which are both in the cranial cavity itself. Okay, petrosal sinus as well as the pterygoid plexus of veins. Coming to the nerve supply, it is supplied by the tympanic plexus, formed by the tympanic branch of the glossopharyngeal nerve, as well as superior and inferior cortico-tympanic nerves arising from the sympathetic plexus around the internal carotid artery. If you have seen this in this picture, if you can see here, this is the external carotid artery. Here will be the internal carotid artery, and here also, if you can see, this is the internal carotid artery, and there is plexus of nerves around this. Okay, so all these plexus will join together to form the glossopharyngeal nerve here, tympanic branch of glossopharyngeal nerve, and the plexus around the intercarotid artery, all joined together to form the tympanic plexus. Tympanic branch of the glossopharyngeal nerve, as well as the superior and inferior cortico-tympanic nerves arising from the sympathetic plexus. You saw the sympathetic plexus around the intercarotid artery. All this will form the tympanic plexus, which will supply the middle ear. Coming to the applied aspects, as I said, the middle ear is not a closed cavity, but it is communicating anteriorly with that of the nasopharynx. So if there is any infections in the nasopharynx, or the throat infections easily spread to the middle ear through the auditory tube or the eustachian tube, and that leads to otitis media. Okay, so and if it is not treated early, then it leads to the chronic otitis media. Okay, so the infections can easily pass from the oral cavity, or the throat infections, or the nasopharyngeal infections easily get transmitted to the middle ear and leads to otitis media. Sometimes fractures of the middle cranial fossa. There are three fossas in the cranial cavity: anterior, middle, as well as posterior cranial fossa. So if there is fracture of the middle cranial fossa, that leads to breaking of the roof of the middle ear, rupture of the tympanic membrane, and causes bleeding through the ear. Sometimes you see bleeding through the ear, along with sometimes even the CSF will be coming out. Okay, this is because of the fracture in the middle cranial fossa and rupture in the tympanic membrane, which leads to bleeding from the ear as well as draining of the CSF. Coming to as I was talking about the mastoid antrum or the tympanic cavity, it is a small circular air-filled space situated in the posterior part of the petrostemporal bone. Okay, I'll show you this picture. Okay, so this is the mastoid process. Okay, this is the mastoid process. Within the mastoid process, so here you can see that this is the middle ear. This is the pharyngotympanic tube which is communicating with the nasopharynx from the anterior wall. The posterior wall, it is communicating through the auditus to the mastodantrum into the mastodantrum itself. This is the mastodantrum, and there are small spaces here within this mastoid process. These are called as the mastoid AS cells, which are communicating with each other. And so this is important. So this is small circular and air-filled space situated in the posterior part of the temporal bone. Okay, mastoid process which is present in the temporal bone, the petrous part of the temporal bone, and it is of the, as I said before, it is already the adult size at birth, just like that of the middle ear. Even the mastodantrum will be of the size of an adult by birth, and it is the size of it is very small. Even though it is adult size, it will be of almost a small pea, like just 1 centimeter in diameter, and a capacity, and has a capacity of about 1 milliliter. That's all, but it is important. Okay, now we'll talk about how it is important. As we saw, there are mastoid air cells within this mastoid process. There are mastoid air cells. They are series of intercommunicating spaces of variable size present within the mastoid process. They vary in number. We cannot exactly number them because they keep on varying from person to person. So these are series of intercommunicating spaces. These are small spaces. Mastoid cells are small spaces which are communicating with each other, and they don't have exact size. They are variable in size present within the mastoid process. Okay, coming to the applied aspect, what is the importance? Mastoiditis is secondary to chronic otitis media. Okay, so if there is any infection of the middle ear, we said the infection from the nasopharynx can easily get transmitted to the middle ear, and if this is not treated early, the infections in the middle ear, which is called as the otitis media. So if it becomes chronic otitis media, then it might leads to transmission of this infection into the mastoid process itself. Okay, to these mastoid air cells as well as mastoid antrum, and that condition is called as the mastoiditis. And the treatment is mastoidectomy. Okay, even if that infection cannot be treated with antibiotics, with high antibiotics, then we have to cut and remove that mastoid process. That is called as the mastoidectomy. Okay, so this is of the importance of the mastoid air cells as well as the mastoid antrum. Then auditory tube, you already seen the auditory tube or the pharyngotympanic tube or the Gestation tube. So here this is the pharyngotympanic tube or auditory tube, which is communicating with the nasopharynx into the middle ear. So any infections here might easily get transmitted to the middle ear. So this is all about the middle ear. So these are the references. If you have any questions, you can pose to me and I will try to answer. Thank you very much.